Good day everyone. My name is Nervosa. I'm here to report Anorexia nervosa. This is a short history about anorexia nervosa. The next cases reported were about 200 years later. In 1873, Sir William Gall, another English physician, coined the term anorexia nervosa in published case report. Also in 1873, a French physician, Ernest Charles Lasque, published description of individual with anorexia hystericae. Miss A, depicted in 1866 and in 1870, after treatment, she was one of the earliest case studies of anorexia. From the published medical paper of Sir William Gall. What is anorexia? Anorexia, also called anorexia, is a potentially life-threatening eating disorder that is characterized by self-starvation and excessive weight loss. The disorder is diagnosed when a person weighs at least 15% less than their normal ideal body weight. Extreme weight loss in people with anorexia nervosa can lead to dangerous health problems and even death. The term anorexia literally means loss of appetite. However, this definition is misleading as people with anorexia nervosa are often hungry but refuse food anyway. People with anorexia nervosa have intense fears of becoming fat and see themselves as fat even when they are very thin. This individual may try to correct this perceived flaw by strictly limiting food intake and exercising excessively in order to lose weight. Ano nga ba ang anorexia nervosa? Ito yung sakit na kaugnay sa pagkatakot na bumigat ang timbang o magbago ang hugis ng katawan. Kalimitan na labis ang pagkontrol ng pagkain hanggang sa level na hindi makukuha ang tamang sustansya ang katawan. Ang anorexia ay maaaring magresulta sa pagkasira ng utak, organ failure, paghina ng buto, pagkakaroon ng problema sa puso at pagkakabaog. Mataas din ang tsansa ng pagkamatay sa ninang sakit na maaaring makuha dahil sa hindi pagkain. Who gets anorexia? Eating disorder like anorexia are more common in females than in males, though the rate in males are increasing. The risk of developing an eating disorder is greater in actors, models, dancers, and athletes in sport where appearance and or weight are important, such as wrestling, boxing, gymnastics, and figure skating. People with anorexia tend to be very high achievers, performing very well in school sports, work, and other activities. They tend to be perfectionists with obsessive, anxious, or depressive symptoms. Anorexia nervosa usually begin around the time of puberty, but it can develop at any time. Sino nga bang mas nagkakaroon ng ganitong sakit? Most especially ang mga babae. Dahil ang mga babae ayaw nilang tumataas ang timbang o nagbabagong hugis ng kanilang mga katawan o tumaba. May ibang babae kasi na sa katawan sila bumubuhos ng self-confidence, kaya pag alam nilang mataba na sila, parang nawawala yung confidence nila sa sarili nila. What causes anorexia? The exact causes of anorexia is not known, but research suggests that a combination of certain personality traits, emotions, and thinking pattern as well as biological and environmental factors may be responsible. People with anorexia often use food and eating as a way to gain a sense of control when other areas of their lives are very stressful. or when they feel overwhelmed. Feeling or inadequacy, low self-esteem, anxiety, anger, or loneliness also might contribute to the development of the disorder. In addition, people with eating disorder might have trouble relationship or have history of being teased about their size or weight. What are the symptoms of anorexia nervosa? The symptoms of anorexia often include the following: rapid weight loss over several weeks or months, continuing to diet, limited eating even when routine or when weight is very low, having unusual interest in food, calories, nutrition, or cooking, intense fear of gaining weight, strange eating habit or routines such as eating in secret, feeling fat even if underweight, inability to realistically assess one on body weight, striving for perfection and being very self-critical, under the influence of body weight or shape of self-esteem, striving or perfection and being very self-critical, under the influence of body weight or shape or self-esteem, depression, anxiety, or irritability, a frequent or irregular or even missed menstrual period in female, laxative, diuretic, or diet pills use, frequent illness, wearing loose clothing to hide weight loss, compulsive exercising, feeling worthless or hopeless, social withdrawal, physical symptoms that develop over time, including low tolerance of cold weather, brittle hair and nails, dry or yellowing skin, anemia, constipation, slowing joints, tooth decay, and a new growth of thin hair over the body. Untreated anorexia nervosa can lead to damaged organs, especially the heart, brain, and kidneys, drop in blood pressure, pulse, and breathing rates, loss of hair, irregular heartbeat, tightening of bones, osteoporosis, fluid electrolyte imbalance, death from starvation or suicide. How is anorexia diagnosed? Identifying anorexia can be challenging. Secrecy, shame, and denial are characteristic of the disorder. As a result, that illness can go undetected or long period of time. If symptoms are present, doctor will begin an evaluation by performing a complete medical history and physical exam. Although there are no lab tests or especially diagnose anorexia, the doctor might use various diagnostic tests such as blood tests to rule out physical illness and the cause of the weight loss, as well as to evaluate the effect of the weight loss of the body's organ. When should I seek help for anorexia? If you suspect that you or someone you know has anorexia or another eating disorder, seek help immediately. Eating disorder can become increasingly dangerous the longer they go untreated. In severe cases, the effect on the body caused by eating disorder can be fatal. Can you help stop anorexia? First, tell them being extremely thin isn't better. Put more important on their personality than their looks. Encourage them to be honest about their feelings. Build their self-esteem. Teach them about the danger of eating. Let them know that you don't expect them to be perfect, because perfect doesn't exist. Here are ways you can help them from getting worse. Ito daw po yung mga bagay na pwedeng makatulong sa kanila para hindi lumala ang sakit. Una, get educated, talk to them, get medical help, give them support, praise and compliment them, build a support network, be their role model. What is the treatment for anorexia? Psychotherapy. This is type of individual counseling that focuses on changing the thinking and behavior of a person with an eating disorder. Itong psychotherapy, tumutulong sila para mabago ang pag-iisip o ang behavior ng isang tao na may eating disorder. Medication. Certain antidepressant medications such as selective serotonin reuptake inhibitors might be used to help control anxiety and depression associated with an eating disorder. Some antidepressants may also help with sleep and stimulate appetite. Dito naman sa medication, nakakatulong dito yung pag-control ng anxiety and depression. And nakakatulong din ang antidepressant sa also help with pagtulog o pag-stimulate ng appetite. Nutrition counseling. This strategy is designed to teach a healthy approach to food and weight to help restore normal eating pattern and to teach the importance of nutrition and following balanced diet. Dito naman sa nutrition counseling, dito tutulungan yung mga may sakit na paano mag-balanced diet or kung paano kumain ng mga healthy food. Group and or family therapy. Family support is very important to treatment success. It is important that family members understand the eating disorder and recognize its signs and symptoms. Dito naman sa family or group therapy, dito kailangan ng support ng pamilya para mas successful ang pag-treatment sa kanila. And importante din ang pag-iintindi sa may sakit. Hospitalization. A mention above, hospitalization might be needed to treatment severe weight loss that has resulted in malnutrition and other serious mental or physical health complications such as heart disorder, serious depression, and risk of suicide. In some cases, that patient may need to be fed through a feeding tube or through an IV. What is the outlook for people with anorexia? Anorexia, like other eating disorder, gets worse the longer it is left untreated. The sooner the disorder is diagnosed and treated, the better the outcome. Anorexia can be treated, allowing the person to return to a healthy weight. Although many people with anorexia deny they have a problem and refuse treatment, although treatment is possible, the risk of relapse is high. Can anorexia be prevented? Although it may not be possible to prevent all cases of anorexia, it is helpful to begin treatment in people as soon as they begin to have symptoms. In addition, teaching and encouraging a healthy habits and realistic attitude about food and body image also might be helpful in preventing the development or worsening of eating disorder. And that's all for my report. Thank you for listening. God bless us.